With new variant strains of COVID-19 in Canada, health officials are urging everyone to think about the masks they are wearing. On CBCNews.ca, read what difference a 3-layer mask can make and learn why medical professionals believe they should be worn outdoors. The advice: it's time to step up mask wearing even with new cases slowing in many places. Let's talk some more about this with Dr. Shazma Mithani, an emergency room physician in Edmonton, and she joins me now. Dr. Mithani, thank you very much for taking the time on all of this because, you know, it's winter and the variants are here, they're more contagious, and we talked about mask hygiene and the importance of wearing masks way back when. But now there's been some new thinking just in terms of really stepping up our game, I guess, when it comes to wearing masks, especially with some of these new variants that are of concern. So do you want to kind of walk us through or tell us what we should be really keeping in mind?
Thanks for having me today, Andrew. So yes, as you mentioned, with the new variant becoming more prevalent across the world, and now we're seeing it in Canada as well, we do know that the new variant is more transmissible, and so that makes the importance of mask wearing even more paramount. And we do have to remember that when we wear masks, we're protecting those around us. So there are two functions of masks. One is as a barrier going outward. That would be the most important barrier. And then less so a barrier kind of towards you. And so when we do wear these masks when we're around other people, the idea is that we're preventing droplets from being expelled from our mouths and reaching the space beyond our mask and protecting those around us.
Okay. So, you know, you've got some masks, I've got some masks. Do you want to show us what you would consider to be, given the variant that is out there that is more infectious, as you mentioned, what would be kind of the gold standard that everyday people, I know it's different for healthcare professionals, but just everyday people who can get it from the pharmacy, what should we be wearing and how should we wear it?
So I have two different types of masks here. I have a surgical mask or a medical mask, which you can get from different drugstores and different stores around the cities and Canada.
It's the 3-ply. They call it, it's 3-ply, right? It's like a 3-ply mask, right?
Mm-hmm,
okay.
Exactly. Mm-hmm. Yeah, exactly. And then I do have a cloth mask as well. That's 3 layers. Mm-hmm. This was made locally, and it does have a pocket where you can insert a filter. But the way that I asked for the woman to make these for me was to put the polypropylene layer in for me. So she sewed that in, and that's one of the layers in addition to paper towels that's recommended by Health Canada. And so that's the cloth mask that I have. The cloth mask that I have also has an aluminum nose piece in it, mm-hmm. which is important from a fit standpoint. So that's an important kind of piece in terms of protection. So one is how well it filters, and then the other one is how well it fits. Okay. And I would say that the fit is one that can be quite finicky and is a really important aspect of masks to get right.
So then tell us about that, because, you know, I don't know if you want to put it on or you want me to put it on, and you can walk me through and we'll see if I'm doing it right. Do you want me to put it on?
Sure, yeah, okay. Yeah, let's do it.
So this is they're 3-ply non-medical surgical masks. So this is, you know, the kind that you throw out after, I guess, one use. Well, we can get into that too. So you put it on like this, and I think you're supposed to kind of have it so that it's snug kind of right around, and the wire's at the top, and it's snug kind of as much as possible below the chin, right? So it's sort of, have I done it right?
Just about. So okay. What I'll use my, like the disposable mask as an example, yep. Since that's used, Andrew. And so first thing that's really important is to always do hand hygiene mm-hmm. first. And so I do have some little hand sanitizer here. And so, yeah, perfect. So you wash your hands first, just in case there's anything on your hands that might have contaminants or anything on it. You don't want to touch your face. Mm-hmm. Then you take your clean mask. What I would do is I would put it on my face, put it around my ears first, make sure it's centered. There we go. And then pull it under my chin. So give it a bit of a pull, kind of unfold it. Mm-hmm. And then go. And then don't pinch it, but just kind of try to flatten it against your nose like this. If you pinch it, there's a risk of of the aluminum piece kind of bending and breaking.
Okay.
And then if you adjust it a bit after that, you can. There we go. And then kind of just pat it along your nose. So make sure there's a really good seal here, below your eyes, a good seal on either side. So you can see that it's sitting flat against my face on both sides. And then under the chin here as well, it should sit pretty close to your chin. And so it is important to open up those folds and pull it underneath your chin just to get the biggest area covered and get the biggest seal around your face.
Because that's what you want. You want to try and keep any droplets from coming out of your nose or your mouth, right? Like that's the point of all this.
That's exactly right. So the areas that are going to be the most prone to that, again, are going to be the sides here, under the chin, and then above the nose. So it is really important to have a mask that fits well and sealed well. So I would actually probably even pull it up a bit higher on your nose bridge there. And then push it and really mold that piece of aluminum.
I kind of have I think I have a big head, so I don't know whether they come in different sizes. I don't think they do generally, but yeah. But
different brands differently. Oh.
Okay. So this is how many uses? Because, so a lot of people wonder how many times you can. So now I've used that. Do I have to throw it out? And because it's a disposable, non-medical surgical mask, and then use another one the next time?
That's exactly right. So I'll kind of talk about how we would take the mask off. So right? So wash your hands again. Because assuming you're out and about and touching things, so wash your hands. And then I usually just use my pinky fingers, loop it around. And if it's a disposable mask, I'm usually near a garbage and I just drop it right into the garbage. So this is a single-use disposable mask. And then again, you would wash your hands again after you touch the mask, because you assume that there might be contaminants on the mask as well.
Okay, so that means that, then to be honest, so people who are working like in an office like where we're working, we wear a mask when we're moving around, but we don't wear a mask when we're at our workstation. So every time you get up, you have to put a mask on. So you're saying we should throw out that disposable mask each time?
That's a tricky question. Ideally, the disposable masks are meant to be single-use only. If you are going to be using a mask multiple times a day, or kind of just to get up back and forth from different places, a cloth mask might be a bit better.
Okay.
They're resilient to break down, and specifically, I would recommend a 3-layer cloth mask.
Okay, so what is it? So a 3-layer cloth mask, does that, those are fine? You want to tell us about those?
Yeah, so Health Canada, as you know, recommends 3-layer cloth masks with cotton as the outside layers, and then either paper towel, which is very easily accessible for people. So you can get masks that are made with filter pockets, or polypropylene as a filter. And the idea with that third filter layer is to filter out more effectively the smaller droplets that are being created when people are sneezing or coughing or talking.
Sorry, is that paper towel that you put into, because I have a mask here that has, I guess this is what you're talking about, right? Where I could take a little pouch and I could take a filter. This is actually a filter, and I would put it in here, right? Like that.
So many masks nowadays, the cloth masks that are made do have a filter. So mine has a little filter pocket here as well. And so you can cut a piece of paper towel to the appropriate size, and you can use that as a filter. Or you can, a lot of the cloth masks have filters that are polypropylene that can be used in the mask as well. And
then you would put it on the same way, just like you did.
You're right. Yeah, you put it on the same way. There are lots of different styles of how cloth masks are made. The one that works best for me is similar to the surgical mask with the folds and with the aluminum nose piece here. There are some similar to what you have there, Andrew, with kind of the shape is different at the top, so it kind of goes around your nose a bit better. I find from a fit standpoint, the most important thing, and what I see often done wrong the most, is making sure that it fits properly and stays over your nose. So the mask is not meant to be worn on your chin or kind of, lifted up over your head. It's supposed to stay covering your nose, your mouth, and your chin the entire time. So one of the quick tests that I actually do for my kids, because I find that the masks are a bit trickier with them, is that I get my daughter to open her mouth really wide to show me if the mask is going to slide down her nose. So it kind of simulates the most extreme version of her talking to make sure that the mask stays on.
Okay. So now I think a lot of people, because at the beginning of the pandemic, and so now we're talking about this in the context of the variants, right, that are more infectious. So, this is another mask that I have. I think this is 2-layer. There's no pouch. It's cloth. Are you concerned that this is no longer good enough?
I would say that any mask is better than no mask. We have to remember that the reason that we're wearing these masks is to filter out the droplets that we're producing. And so the droplets are going to be unchecked if there are no masks being worn. So it is important to continue wearing whatever masks you do have. Ideally, it would be a 3-layer mask, but if that's not possible for whatever reason, then any mask is better than no mask.
What about doubling up? Like we saw U.S. President Joe Biden. He sort of had, I think it kind of looked like, there it is. So there you can tell that there's a surgical mask. Well, why don't you describe what we're looking at?
Yeah, so what I'm seeing in that picture, from what it looks like President Biden is wearing an N95, what looks like an N95 under a surgical mask. So that's probably overkill. So the N95 has 2 uses. So it's a bit of an additional layer of protection for yourself as well. So the idea of an N95 is that not only does it filter the droplets going out, but it also protects you from droplets and airborne transmission coming in towards you. And so that is true personal protective equipment in that it actually protects the wearer of the mask versus the people around the wearer of the mask. With regards to doubling up on surgical or cloth masks, I would say that adds extra protection in terms of the droplets being expelled, and it may offer some extra protection to the wearer of the mask as well.
So I want to ask you, I just put this mask back on. I think I listened to how you told me to do it. You also want to make sure, so I'm going to breathe and you can see me. That's what you want, right? You want to be able to sort of be able to breathe properly like that through your mask, because some of them you can't do that, right? Like some of them it's a little harder to breathe properly, right through your nose or through your mouth.
Absolutely. So a couple things there, Andrew. So one, you do want to be able to see the mask moving while you're breathing, because that means that it is catching the breath that you're expiring, right? And so the idea is that it's then catching the droplets that you're breathing out. But then the other thing from a comfort standpoint is that you want to be able to make sure that you, while you're wearing the mask, can breathe comfortably while you're wearing it. So that's the one thing that is something to consider if you're going to double up on the cloth masks, is you want to make sure that you can still breathe normally and breathe easily with those 2 masks on, because one of the potential downsides of that would be that if you are going to be touching your face and finicking with the masks while you're wearing them, it kind of introduces the risk of contaminating yourself. So one of the important points to remember is that when you have a mask on your face, you really should not touch it. Only touch with clean hands, and really you should only be touching your face to take your masks on and off when you're around other people. Let
me ask you more generally, with the variants, are you concerned in a city like Toronto or Montreal, where there's concern about the variants maybe circulating in the community and other places in the country? If you walk to work and you're on the street, can you walk by someone where you're not required to wear a mask? Can you walk by someone without wearing a mask? Or are we now at the point where you would recommend wearing a mask wherever you are, outside, if you're maybe on a city skating rink, that kind of thing?
I think the concern with the new variant right now is that we really don't know enough about it to know how much more transmissible it is. We do know that it is more transmissible. And so the logical next step would be to increase mask wearing and really increase our diligence with the ability to protect ourselves and protect those around us. And so we're allowed to have outdoor exercise and gatherings in Alberta now as of last week. And so I went for a walk in the neighborhood with a friend of mine last week. We maintained our 2-meter distance, but we still were both wearing masks the entire time, just for everybody's protection. And so my recommendation is always to err on the side of caution. We know that the new variants are more transmissible, and so in situations like that, when you're outdoors, it's better to protect yourselves and protect those around you and wear a mask, I think.
This has been very helpful. Is there anything that you feel like I didn't ask you about that you want people to know when it comes to proper mask wearing during the winter as these variants are circulating?
I just think it's really important to reiterate that hand hygiene is really important when you're wearing masks. Wearing a mask in and of itself is a really important step in protecting those around you. And so mask wearing saves lives, it protects those around you, and it's really important to have a mask that fits you well. And so the layers do play into it, but it's important to also have a mask that is comfortable, that you can wear for a prolonged period of time and does fit you well around the nose, the side of the cheeks, and under the chin as well.
Dr. Mithani, this has been extremely helpful. Really appreciate you taking the time and walking us through this. Thank you very much.
Thank you so much, Andrew.